Well, my friends, now I am presenting a video of a new dimension, a new outlook to many of you. The disease is known as tethering spinal cord. The normal English meaning of tethering means a binding, chaining. A horse is being tethered with a rod. ঘোড়াকে রডের সাথে বেঁধে রাখা হয়েছে চেন দিয়ে। টেথার মিন আটকে দেওয়া, বেঁধে রাখা। So tethering of the spinal cord means a spinal cord, you know the spinal cord, which is the prolongation of the brain and which comes downwards from the middle of longata downwards up to the lumbar 1 vertebral level. After that, it bifurcates in the tail-like horses and known as phylum terminally. So, the spinal cord is disturbed. আটকে গেছে ভার্টিব্রাল কালাম, যে ভার্টিব্রাল কালামের মাঝখান দিয়ে স্পাইনাল কর্ড নার্ভটা যাচ্ছে, মোটা নার্ভ, প্রলঙ্গেশন অফ দ্য ব্রেন, কোনো এক জায়গায় মাসেল বা টিস্যু তাকে আটকে রেখেছে। সাপোজ দিস ইজ দ্য স্পাইনাল কর্ড, it coming within the vertebra and it has been attached to somewhere, কোনো একটা জায়গায় আটকে গেছে। লাইপোমা সাধারণত ফ্যাটি টিস্যু বা লাইপোমা দিয়ে আটকে যায়। সো tethering of the spinal cord is a disorder of the spinal cord which comes under the nervous system, nerve-related disease caused by tissue attachments itself to the spinal cord and limits or restricts the movement of the spinal cord. The tissue attachments may be present from birth, which is known as congenital, or may be acquired. It may deposited after the birth. So, the developed near the site of the spinal cord is the tethering of the spinal cord. The course of the disorder is progressive, আস্তে আস্তে অনেক সময় বাড়তে থাকে, which means it gets worse at times and goes on. In children, the symptoms generally weakness of the legs, difficulty to walking, pain in the lower limb, scoliosis, সামনের দিকে বেঁকে যায়, loss of bowel and bladder control. The bladder control disturbs and sometimes the night waiting or bed waiting or involuntary urination at night during sleeping may occur. So this is about the tethering of the spinal cord. So it is the thickened phylum terminally or anywhere in the spinal cord. Presentation may be with progressive neurological deficit, spasticity, bladder dysfunction, as I already been told, or scoliosis, সামনের দিকে বেঁকে যাওয়া. The allopathic mode of treatment, the medical treatment is nothing but surgery. So, surgical invention or the surgical treatment involves কি করে? Untethering. Tethering should be untethered. তাকে ছাড়িয়ে দেওয়া হবে ওই জায়গাটাকে যেখানে আটকে রেখেছে। Untethering of the cord to prevent further neurological deterioration. The lipomas may occur within the normally located conus and the lipoma is removed. এই বাচ্চা মেয়েটির the present age is 16 years, now brought to me from Purulia. The disease was tethering of the spinal cord, for which she had operated in the Krishna Institute of Medical Science at Andhra Pradesh, Secunderabad. Tethering of the spinal cord And this tethering of the spinal cord was operated from the Krishna Institute of Medical Sciences Limited at Secunderabad of Andhra Pradesh. So 3 years after operation, before operation, there were no too much disturbance, খুব একটা প্রবলেম ছিল না, কিন্তু তবু সার্জন অ্যাডভাইস করেছিল অপারেশন করার জন্য, যে অপারেশন না করলে পরে খারাপ হতে পারে, ইট মে বি ওয়ার্স, দি কন্ডিশন মে বি ওয়ার্স, so it is better to operate. They given the advice, and according to the advice of the surgeon group, the parents decided to operate, and the child was operated when her age was 10 about. But operation didn't give the final result. The operation given only relief for few years, that the permanent solution is not found. Now, the condition is still deteriorating. Tethering of the spinal cord. Here is the operation site, and there is scoliosis. Now the condition is so bad, the girl cannot walk. It is quite impossible to walk, even stand. দাঁড়াতেও পারছে না, ঠিক মতো হাঁটতে পারছে না। তুমি একদম হাঁটতে পারো না, হাঁটতে গেলে কি হয়?
I face difficulties walking.
It is quite difficult to walk.
Yes, I cannot even stand.
It will fall down.
Yes.
So it was chance to, before operation, by homeopathic treatment, as the symptomatology totally correspond to calcarea carbonica. Now the symptomatology also in favor of calcarea carbonica, so may we try for this poor girl to improvement of his further tethering by spinal cord, because she is chilly patient, profuse or abundant perspiration, chilly patient, and the physical makeup is fair, fatty and flabby, so all symptoms go in favor of calcarea carbonica. So let's see the result, my friends. I do like to prescribe calcarea carbonica on considering the chilly patient, desire for salt and sweets, and profuse perspiration, etc. Not only that, the mental symptoms of this gentle girl represents calcarea carb. There is fear of thunderstorm, fear of ghosts, fear of dogs, fear of animals, and fear is in every spheres of life. So let's prescribe calcarea carbonica for further untethering the spinal cord of this poor gentle lady. Let's see the result. I shall share you, my friend.